that I look at most clinical trials is that they offer most of our patients access to drugs before they're FDA approved. And certainly you might say that, well, most drugs that are in the clinical trial process are not FDA approved. But I think at least our group and many of the oncology groups have a pretty good nose at picking out what may look promising and really try to get them into their centers. And in fact, it's very competitive to get the clinical trials into the centers. And clinical trials are the way that we really are able to advance the field and better treatments for our patients, making them live longer, making them feel better. It's how we advance it. Clinical trials are key. Look at the example of the Herceptin adjuvant trials, and I think everyone in the breast cancer would agree that the data presented at ASCO a few years ago that Herceptin in the adjuvant setting markedly reduces risk of relapse and death by about 50%. It's mind-blowing.
Mm-hmm.
And in those particular clinical trials, the Herceptin trials, it was placebo, standard chemotherapy versus standard chemotherapy plus Herceptin given two different ways. And those patients who went in the trial and actually got Herceptin, they got Herceptin a couple of years, 3 or 4 years before it was considered standard of care. Now you would never not consider giving a HER2 positive patient Herceptin in the adjuvant setting. And even the patients who were in the arm that did not get Herceptin, they were actually given Herceptin free before it was approved, say, by insurance companies or had an adjuvant indication. So even though they didn't get it within the original context of the trial, they got it way before anybody else. So I think that early access is important. And so, just even thinking about some of the data or some of the recent trials with the bisphosphonates in breast cancer, I think the way it's really panning out is that bisphosphonates or bone strengthening drugs can reduce the risk of developing metastasis. And we've been actually participating in bisphosphonate trials for a long time and always sort of discussed it as, well, we think these drugs can help prevent metastasis. So with the latest data coming out from the Austrian Breast Cancer Study Group, which really puts a number on it, a reduction in risk of about a third, all our patients are coming back and they're really happy and they're like, oh, I'm glad I got that Zometa, 4 years ago, because not only did it strengthen my bones after I got my chemotherapy, but probably helped to reduce my risk of tumor coming back. So it's a good feeling all the way around,